Good afternoon and welcome. My name is Bill Bodner, and I am the Special Agent in charge of DEA's Los Angeles Regional Office. I'm thrilled the state of Nevada, and specifically the city of Las Vegas, has been chosen to host the DEA 360 program. I believe we are at a crucial tipping point with respect to drug education, the treatment of drug addiction, and drug law enforcement. Last week I was asked if I was surprised multiple students at a large California college died of drug overdoses. My honest and direct answer, unfortunately, was no, not at all. As a matter of fact, I would be more surprised if you told me there were no overdose deaths at a large college campus in California. You see, drug use, drug addiction, drug-caused deaths, these things don't discriminate. They don't know privilege. They affect all of our people across all the spectrums of race, color, religion, sexual orientation, and socioeconomic status. There's also another factor we need to be aware of, and I'd be remiss if I didn't discuss it with you today. It's something I heard former New York City Police Commissioner and former Los Angeles City Police Chief Bill Bratton say. Bratton said, "Be careful what you tolerate, as it will become the norm." So am I surprised in California, a state which 6 years ago decriminalized personal possession and use of hard drugs like heroin, methamphetamine, PCP, and fentanyl? Am I surprised young adults died of drug overdoses on a college campus in California? No, I'm not, because unfortunately what we tolerate becomes the norm. We should not tolerate teenagers going uneducated on the dangers of opiates and today's powerful synthetic drugs. We should not tolerate people suffering from the disease of drug addiction going without treatment, and we should not tolerate criminals trafficking drugs in our communities. Ladies and gentlemen, the truth is drug trafficking is not a victimless crime. There are people victimized every day. At its core, the DEA 360 program is designed to stop the victimization. Please decide what you are willing to tolerate and dictate what tomorrow's norm will be. Thank you. I will now introduce DEA's leader on the ground for the state of Nevada, Assistant Special Agent in Charge, Dan Neal.
Good afternoon. My name is Daniel Neal, the Assistant Special Agent in charge of the Drug Enforcement Administration, DEA Las Vegas office. On behalf of the men and women of the DEA Las Vegas, welcome. Welcome to the Westgate Resorts, specifically to the suite known as the Elvis Suite, because Elvis performed here in this very resort many years ago. Ironically, Elvis died over 42 years ago of a drug overdose. Today, we are at the Westgate Resort to kick off an initiative called DEA 360 Strategy. DEA 360 Strategy is a three-prong approach to tackling the cycle of violence and addiction generated by the link between drug cartels and the violent street gangs and the rising problem of prescription opioids and fentanyl abuse in the United States. Las Vegas was selected as one of 4 cities throughout the United States for this very special program. Nationally, 192 people die per day for drug overdoses. That's over 70,000 per year. Of the 192 people that die of drug overdoses, 68% of those are from pharmaceutical drugs or pharmaceutical opioids or heroin. Enough is enough, folks. Enough is enough. Let me give you some more staggering statistics here in Clark County. If this doesn't get you angry, this will. In Clark County last year, there were 717 drug overdoses. 46% were from pharmaceutical opioids or heroin. That's too many. This is our community. I live here with you all here. This is my community too with you. It's time we do something. The DEA 360 strategy will do the following. First, It's going to coordinate law enforcement efforts and operations, federal, state, and local partners, targeting all levels of drug trafficking organizations and violent gangs, supplying to our neighborhoods here in Las Vegas. The second part of this plan is the diversion control, engaging drug manufacturers, wholesalers, practitioners, pharmacists, and encourage responsible prescribing practices. And in fact, this fall, we're going to host a summit with parents and teachers, and we're going to talk about this and educate our parents and teachers about this very problem. And finally, a part of this three-pronged approach is the community outreach, which we've been doing a great job the last 2 years over this. The Opioid Youth Summits is one of those, the Youth Dance Program. And at first, for DEA, we're going to be having an after-school program for kids to teach them soccer. Because statistics show that from 3 to 5 p.m. is when kids are most vulnerable to try drugs. So we're partnering up with the DEA Educational Foundation and Portugal Sports Academy, and this initiative will start next month. Listen, this whole issue is really kind of personal to me, too. I have a 16-year-old son who's an incredible athlete. He goes to school here in Clark County, right? And my biggest worry as a parent is him getting hurt, him falling into a horrible cycle, and misusing prescription drugs. That's what keeps me up at night, because it's real. People die every day from this. 2 years ago, we initiated the Opioid Youth Summit to reach out to teenagers throughout Clark County, and for the last 2 years, we've educated over 2,500 middle school and high school students of the dangers of misusing opioids. What's wonderful about the program and the programs that we're going to be doing in the future, and as you can tell from the folks that are standing here with me, standing to fight against this, we can't do it alone. And that's why we have our community partners, and we have our law enforcement partners, and it's a team effort to educate our folks here. I would be remiss if I didn't thank all the many different folks that are helping. Sands Corporation, UFC, Las Vegas Raiders, Hakkasan, the U.S. Attorney's Office, the DEA Educational Foundation, Westgate Resorts, Victoria's Voice, the Nevada State Elks Association, Las Vegas Metro Police Department, North Las Vegas Police Department, Henderson Police Department, Clark County School Police Department, CCSD, the Nevada Attorney General's Office, Clark County District Attorney's Office, Clark County Fire Department, Assemblyman Tom Roberts, Judge Christina Silva, the Coroner's Office, local drug coalitions, HIDA, the United States Marshals Service. The folks behind me represent all those. I'm very proud to be standing here with each and every one of them. I want to thank you, each and every one of you, for being part of this invaluable coalition. Now I'd like to present Nevada Attorney General Ford.
Thank you so much for including me. Good afternoon, everyone. My name is Aaron Ford, and I'm your Attorney General. I'm honored to be here today to be a part of this collective response to the opioid crisis that's wreaking havoc on our state and in our nation. Though I'm proud to be here today as your Attorney General, I'd like to talk to you as Aaron Ford, the father, a father of 3 boys and a nephew that my wife and I raised. As a father, nothing is more important than knowing your kids are safe and that they are healthy. It's easy to think about drug abuse as something that doesn't affect us. We may think those impacted by drugs choose their path and that they deserve what's coming to them. But drug abuse, as you've heard, can affect anyone. No one is an outlier. No one is immune. Young or old, rich or poor, educated, uneducated. Drug abuse is the leading cause of death in America for those under 50. This is more than just a sobering statistic. It also means that drug abuse is killing more Americans under the age of 50 than car crashes, than firearms, and than heart disease. And these opioids, these drugs, are being marketed as safe, making them all the more dangerous. Many Nevadans are infected. In fact, an average of 1 Nevadan dies every day due to drug overdoses. While progress has been made, such as the average life expectancy increasing for the first time in 4 years as the number of fatal drug overdoses have declined, a lot of work still needs to be done. Various factors are attributed to the decline in opioid deaths, such as the availability of the medication naloxone, which can reverse an opioid overdose, and a focus on treatment. These types of collaborative efforts, which we're here today to discuss and celebrate, are paramount in continuing to address the drug crisis. Not only do we need to see a decline in fatal overdoses, but we also need to see a decline in non-fatal overdoses. We need to get individuals with substance abuse disorders into treatment, and we need to focus on prevention activities. Collaboration with federal, state, and local partners across the spectrum of law enforcement, fire and emergency medical services, public health, healthcare, treatment and behavioral health providers, and nonprofit and community organizations, to name a few, is a major factor in reaching positive outcomes. No one agency, that is, can fulfill this mission on their own. That's why the Drug Enforcement Agency's 360 strategy will be an important component in trying to combat the opioid crisis. My office has been actively addressing the opioid crisis as one of my priorities of criminal justice reform. Helping those with substance abuse disorder and providing the life-saving medication naloxone to first responders are a few examples my office has worked on to address the opioid crisis. A hurdle has been the stigma attached to substance abuse disorder. The ability to break down that stigma and talk about substance abuse disorder is an important step in getting help to those who need it. As your Attorney General, I am excited to continue to work with the DEA in support of its 360 strategy, and I commend all of its proactive efforts. In closing, I'd like to share a message with any and all Nevadans struggling with opioid addiction. I would like each of you to know that we are here to help. My office, our offices are here to help. These men and women alongside me are here to help. And the state of Nevada is here to help. We stand behind you in this effort. Thank you again for having me.
Thank you. Now I'd like to present to you the United States Attorney for the District of Nevada, Nick Trochanich.
Good afternoon. It can't be understated, and so I'm going to say it up front. DEA's designation of Las Vegas and the opioid 360 strategy that goes along with it is a big deal, and it's going to save lives here in Las Vegas and throughout Nevada. That's why I want to thank DEA for the extra resources that come along with the opioid 360 designation. I also want to thank the leaders of local law enforcement that are present behind me today, as well as the leaders in private industry who are here as well. They've spent time, resources, and energy over the last many years trying to save lives on this very issue. On behalf of the U.S. Attorney's Office, I have a profound respect for the Department of Justice and the Drug Enforcement Administration and everything that we do together. The opioid 360 DEA strategy is something that we do together very, very well. It works. 4 other cities in the country have had this designation, and it's worked in each one of those cities. That's why I want to express my gratitude. My gratitude to the DEA, and particularly Assistant Special Agent in Charge Dan Neal, for helping foster and create an environment here in Las Vegas where we're open to having DEA designate this city through this 360 strategy. I also want to recognize the people, the leaders in private industry that are here today, including the owners of the Westgate and the Siegel family, for their work on this issue. It's also important to recognize this community, because without the involvement of everybody here today, DEA may not have made this designation. And that's why it's so important. If we step back a little bit, this nation is in the midst of an opioid crisis, and Nevada is no different. The numbers bear that out. In 2015, there were 2.4 million prescriptions of opioids in this state. That's 83 prescriptions for every 100 persons in this state. In 2016, over 408 overdose deaths in Nevada. One death is too many. 408 is astronomically high. In 2017, the very next year, DOJ responded by designating Nevada as a hotspot for the opioid epidemic. And with that designation came extra prosecutorial resources. And we've since been working hand in glove with our federal agency partners and our local law enforcement partners on the enforcement side, going after dirty doctors, going after cartels, going after gangs that push this poison onto our streets and into our schools. And that's where the DEA 360 strategy comes in. This designation allows us to focus on 3 key priority areas: enforcement, diversion, and community involvement. On the enforcement side, what I'm talking about are those cartels and those gangs that are pushing dangerous opioids like fentanyl and heroin into our schools and into our communities. Diversion, I'm talking about going after dirty doctors, drug dealers with lab coats that violate their oath to do no harm and feed into the addiction of their patients for greed. With respect to community involvement, although this is a DEA designation, it's community-led, it's community-owned, and that's why I have all the confidence in the world that this designation is going to save lives and it's going to prevent overdoses here in Las Vegas. Thank you very much.
All right, now I'd like to present to you Mr. David Siegel, President and Chief Executive Officer for Westgate Resorts.
Good afternoon. Thank you for coming. There's no greater problem that this country has than the drug epidemic. 190, as you heard, 192 people are dying every day from a drug overdose in this country. We keep hearing about the coronavirus. Not one person has died, but it's taken the headlines of the papers. But you don't hear about the 192 young people, our future generation that's dying every day. An airliner is crashing with 192 passengers every day, and you're not hearing a whimper about it. Well, thank you for coming, because now you are hearing about it, and I hope that you pass the news on to every person that's watching and listening. This is a serious problem. We lived it firsthand. My wife, Jackie, and I lost our beautiful 18-year-old daughter, Victoria, to a drug overdose 4 years ago. And it's a tragedy that no family should have to experience. But we're doing something about it. We have dedicated the rest of our lives to fighting this horrendous epidemic, or I should say pandemic. And one of the things that we are doing, and you're going to hear about it shortly, is the Victoria Voice Foundation has started the Victory Clubs. And the Victory Clubs are going to be in the schools. And frankly, for lack of a better word, we're going to bribe the students to stay drug-free by offering them benefits that they could never get before. For example, the schools are going to let them out early to beat the traffic. They're going to give them preferred parking at the schools. They're going to give them a head-of-the-line pass in the cafeterias. They're going to get preferred seating at football games and concerts. The local merchants are going to give them free movie tickets, free pizza, free popcorn, free subs, free gameplay. The NASCAR racetrack is going to give them free admission to races, to concerts. There's hundreds and hundreds of benefits that they're going to get, and all they have to do is be drug-free, alcohol-free, cigarette-free, and vaping-free. And in return for that, they get admission, they get drug tested, they get admission to the Victory Clubs, and then they agree to be randomly tested throughout the year. This is the first preventive thing that is now being done. We treat them after they're addicted. We give them medicine to work on the addiction. We put them in rehab. We give them counseling. But nothing has been done so far to prevent them from doing it. So this is what Victory Clubs are going to do. We're starting in 3 high schools in Clark County and 3 high schools in Orlando, Florida in September. The next year, we're going to roll it out, hopefully, to all the high schools in Clark County, all the high schools in Orange County, Florida, and hopefully by the 3rd year, we'll be rolling it out nationwide. It's been approved by the DEA. It's been approved by the drug czar in Washington. Everybody we've talked to is positive about it. We're excited to do it, and we're going to save lives, and that's our purpose in life, is that no family will suffer what we suffered by the loss of our daughter. By the way, we wrote a book about our daughter, her fight with drugs, and every one of you here today is going to get a copy of it before you leave. It's called Victoria's Voice. It's very compelling. Once you start, you're going to have a hard time putting it down. But this is not a book to put on a shelf. This is a book to read and then pass it around, because this book will save lives by educating people on the horror of the drug epidemic. Thank you for coming, and welcome to we're very proud of this hotel. I guess you could say that Elvis was the first famous drug overdose victim, and fortunately, a lot more people have died since he did. Thank you.